All right, so let's dive in. Trying to get a solid grasp on a field like oncology, I mean, it's huge, right? It can feel pretty overwhelming for anyone just starting out or even trying to keep up.
It really can. Just the sheer scope of it,
Wow.
Understanding the biology, the treatments, the patient side, it's immense. So finding, well, structured ways to learn is absolutely key.
Exactly. And that brings us nicely to our source for this deep dive. We're looking at a description for a specific resource. It seems designed precisely for this challenge. 100 Questions and Answers in Oncology for Medical Students by Dr. Atef Ahmed.
Right. So our task here isn't just, reading the description. It's more about digging into what it tells us about the book's whole approach. How is it framed? What's the philosophy behind it, according to this description? And why might those features be useful for learners?
Okay. Well, the first thing that really jumps out is the format itself. It's built around questions and answers. The description really leans into this. Why do you think that Q&A approach is presented as such a central thing?
Yeah. It's interesting because the description doesn't just say it's Q&A. It seems to explicitly connect that format to making complex stuff more approachable and digestible. But also, and this seems important, it mentions sharpening clinical thinking,
Oh,
which suggests it's maybe less about passive reading and more about actively, engaging with a problem, thinking it through, kind of like real clinical work.
so getting your brain working, asking the right questions, not just soaking up facts. Makes sense. The description also notes the author, Dr. Atef Ahmed, is a seasoned medical educator. How might that background play into it?
Well, I think that's quite relevant. Someone who teaches medicine understands where students usually stumble. They know the common points of confusion, the typical questions that pop up when you try to actually apply the knowledge. So that experience likely shapes how the questions are framed and probably the clarity of the answers based on what the description implies.
Right, anticipating the learner's needs. Okay, let's talk scope. The description uses the term comprehensive coverage. What areas does it suggest the book actually covers?
It seems to paint a broad picture. It mentions diagnosis, various treatments, molecular genetics, which is, huge now.
Uh-huh. Patient care, too, and even touching on the latest advancements. It suggests a pretty holistic view, connecting the science to the clinic.
Yeah, from foundation to the cutting edge, seemingly.
Oncology is just so vast, though. Covering all that in only 100 questions, that feels, well, ambitious. Does the description give any clues about how it manages that? Balancing breadth and depth in that format.
That's a really good point. The description, it promises breadth, but doesn't spell out the exact mechanism for balancing it within just 100 questions. However, the focus on approachable and digestible and sharpening clinical thinking, it might suggest the questions are chosen very strategically. Maybe they hit high-yield topics, core principles you can apply more widely, rather than trying to cover every single tiny detail. More about triggering the right thought processes.
Okay, that makes sense. Focusing on the critical concepts, the ways of thinking, rather than an encyclopedic list. The description also makes a point of saying the content is current and evidence-based. Why is that so critical in oncology, and why highlight it?
Oh, absolutely critical. This field moves incredibly fast. New drugs, updated guidelines from trials, new insights into tumor biology. It's constant. So any learning resource basically has to be current, otherwise it's quickly outdated. Highlighting that in the description is like a signal of relevance, of reliability. It reassures the learner they're getting up-to-date information.
Right, it needs to be a tool for a dynamic field. We touched on this, but let's circle back to the claim about enhancing critical thinking, moving beyond rote memorization. How does the Q&A structure, as they describe it, actually encourage that?
Well, think about how medical learning works, or should work. It's not just collecting facts, it's applying them, right? The Q&A format, as it's described here, likely forces that application. A question might make you pull together pathology, genetics, clinical science. Or a treatment question might require weighing different options based on the evidence presented. It's that active process of using information to find an answer. That is critical thinking. It's vital for real clinical problems, which rarely have simple textbook answers.
So it's training you to think more like a clinician does, working through problems presented as questions. And who does the description target? Who is this book ideally for?
It's pretty specific there. It says ideal for medical students and calls out aspiring oncologists. But it also mentions healthcare professionals wanting an update and even educators needing a teaching resource. So it seems aimed at anyone in the medical field needing a focused way to learn or refresh their oncology knowledge.
Okay. So pulling it all together, what's the overall promise? What outcome does the description suggest for someone using this book?
It promises quite a bit, actually. Things like a pathway to understanding the nuances, insights into cutting-edge research, and being a stepping stone for exams or specialization. It really positions the book as more than just info. It's framed as a tool to help you move forward in your learning and career in oncology.
Yeah, less like a dictionary and more like a guided workout for your clinical brain.
That's a good way to put it. And the description also mentions practical things like a user-friendly format, easy navigation, suggesting it's useful for quick reviews too.
Okay, so let's recap for you, the listener. Based purely on this description we've been analyzing, what does this resource appear to offer?
From what we've discussed, Dr. Atef Ahmed's 100 Questions and Answers in Oncology for Medical Students is presented first and foremost as a way to tackle oncology's complexity using this structured Q&A approach.
And the description emphasizes its comprehensive scope: diagnosis, treatment, genetics, patient care advancements, all supposedly grounded in current evidence-based practice.
Yeah, and it's clearly aimed at medical students, future oncologists, and other professionals needing to learn or update, positioning itself as a bridge to deeper understanding and career goals.
And that Q&A format, it's not just presented as a layout. The description really stresses its role in making tough concepts digestible and, maybe most importantly, actively sharpening clinical thinking skills.
Which links back to that initial problem, doesn't it? How do you handle the information overload? Well, a resource described like this, focused, current, designed to make you think via questions, offers one potential strategy for navigating that complexity.
So as you think about learning in oncology, or really any complex, fast-moving field, here's something to consider, sparked by this description. The source highlights that this Q&A structure is key to moving beyond rote memorization towards critical thinking. In a field like oncology, where knowledge is constantly being updated, how might learning structured around actively answering specific application-focused questions better prepare you? Not just to know facts, but to actually think through the new challenges that will inevitably arise.